Nancy with the Hospice Care Plan and Odonata Care. We were talking about breathing techniques to decrease anxiety. This one is called the 4-7-8. It is very effective, and if one practices this for 2 to 3 minutes, it can really decrease anxiety. It's even gotten patients off of medications designed for anxiety, such as a benzo, Valium, lorazepam. This one, you want to breathe in through your nose for the count of 4. You're going to hold that breath for 7 and then breathe out for 8. Again, as in all breathing exercises, it does not matter what the speed of counting is. You want to start at a speed that's very comfortable, and as you practice it, you will find that your own body is allowing you to breathe slower and more regularly. When you hold your breath and take a deep breath, it puts pressure on your heart. Your heart is slowed, and this decreases the amount of pressure on the adrenaline, the adrenals. You decrease the amount of stress hormone that is released. This is why these relaxation breathing techniques work, because there is a physiological improvement in the hormonal milieu within your body. You also get a much calmer outlook too. So let's practice this, and I will do it with you. So we're going in, hold, out, in, hold, out, repeating the process. It is in for 4 through the nose, hold for 7, out for 8 through the mouth, blowing as if you're blowing through a straw. Practice this for 2 or 3 minutes, and you will absolutely decrease not only your own feeling of stress emotionally, but it will actually change the physiology to decrease the stress hormones in your body, and you will be less anxious. Please try this for yourself. Get it. If you're a caregiver, get it in mind, understand how it works, and then teach your hospice or any of your patients who are feeling anxious, before they pop a pill, ask them to work with you on their breathing techniques. It's something they can do anytime, standing in a line, being in bed, watching television, something that's caused them to feel anxious, something that's looping in their head and they can't put that thought aside. Teach them that the first thing they should do is consider their breathing, practice relaxation breathing. That's it for today. Please watch our videos at the Care Plan on YouTube, and go to our website, odonatacare.com or thecareplan.net. We so appreciate sharing our information on end-of-life care with you. Thank you.